And we'd like to welcome Dr. Marie Walker from the Rockford Spine Center to the 23 Morning Blend. And good morning, Dr. Walker.
Good morning.
All right, let's talk a little bit about, well, first of all, give me some of the numbers. How people sit more than they probably think they sit. It's like one of those questions, how much TV do you watch a day? And those numbers are kind of eye-opening as well. How much do people sit a day?
Well, surveys suggest that the average person sits 8 hours a day and sometimes up to 15 hours a day.
Yeah, well, if you have a sitting job, for example,
Exactly.
I sit, and you know, a lot of folks sit in office work, do a lot of sitting.
Right.
You can't avoid it, can you?
Sometimes not, but there are ways to kind of combat sitting disease, which is essentially just a term that we use to encompass all the ill health effects of sitting too much.
And what are some of those effects?
Well, obesity, diabetes, cardiovascular disease are kind of the obvious ones, but actually what people don't realize is it actually can affect a lot of spine conditions as well. It can make you prone to back pain and also increase sciatica symptoms when you stand and walk, like the leg pain.
Leg pain.
Yeah.
Because you sit too much. Well, just get a better chair then, right? I mean, can't you get some of those great chairs that are ergonomically fit and that can... No, that doesn't...
No, it actually has more to do with how when you sit too much, it weakens your core muscles, for one, and it also shortens your hip flexors, so you're stuck in that sitting position, essentially. So when you go to stand, you're kind of in a bent forward position. And when you try
sound like you're talking about me. We
no,
haven't met before.
No.
I got a sore back, and it take me like 5 minutes to straighten up.
Yes, we're creating sitting disease right now.
So I'm a classic case then, it sounds like. And I'm sure there are a lot of people like that have a tough time getting up after a long period of sitting.
But there are some ways you can try to counteract it. You can try to talk on the phone while standing up. You can park further away and walk into stores or walk to work further.
Okay. Is there anything you can do while sitting? Are there like exercises you can do in your chair if you have to stay anchored to a computer monitor or a phone or something like that? Can you do some with your legs or with your back while sitting?
Well, as far as weakening the core, yes. If you stand up straight, you do engage the core to be able to hold yourself upright, but it still doesn't it doesn't help the hip flexor contractures. So you really need to stand. That's why there's this campaign, Just Stand, and there's a website, juststand.org. It can give you some tips on how you can counteract sitting disease.
All right, and it'd be anything from just walking 10 minutes or around the building or inside the building can help, right?
Walk and go get coffee, and instead of having your coffee, your K cup or tea cup.
Then you're unproductive, and then
Yes, right. So you have to make a choice, I guess.
How many people? I mean, you see as a spine doctor, how many people do you see have signs of sitting disease, and what are the long-term ramifications of this? You mentioned the health factor with diabetes and overweight, but spine problems, what are the long-term effects of that?
Well, I unfortunately see it quite a lot, and when people have sort of a sedentary lifestyle for a period of time, it's very hard to get them out of that. But you can. It just takes a lot of effort, and the ill effects are essentially just chronic back pain and increasing sciatica symptoms from people who have a condition called spinal stenosis.
So that's what sitting disease turns into then? Is that what...
No, that's usually just an effect of arthritis, but it'll increase the symptoms of it if you develop these hip flexor contractures, like shorten these muscles, because it's really hard to stand up straight, and when you do, you arch your back, and it makes the nerves get pinched more. So it's kind of technical, but it's just can make your back pain worse and your sciatica symptoms worse.
And the solution is get up, and I feel like we should stand up and finish this interview now.
Yes.
You're making me feel guilty
We should
here.
do jumping jacks. Yeah.
Jumping, I mean, is that, I mean, being active when you
Really,
walk, or just walking is
honestly,
fine?
just standing.
Just
standing.
Oh, let's just
Well,
stand.
let's just stand.
Yeah, let's finish
let's
this up.
just
Okay.
stand.
Now, so just standing,
Yes.
that will help. It's
You're
that's
engaging
simple.
your core, you're strengthening your your leg muscles, and you're preventing hip flexion contractures, which
Okay.
is all helpful.
All right.
So here we go.
So we're standing. I feel better already.
I do too.
Well, if you want to learn more about sitting disease, there is a website. It's called juststand.org. There's some tips there on how you can get more active at the workplace, and also you can take a stand too. There's a wellness summit July 17th there, but check out that website. It's got some facts and figures and information about the so-called sitting disease and ways to help fend it off, so we can keep Dr. Walker less busy with spine issues, right? You don't want to see a lot of us.
No, I'd rather people just
follow
prevent
the tips.
seeing me. I see plenty, but yes, I'd rather you prevent it.
So juststand.org is the website, and thanks for letting us in on something that you feel you got a safe job sitting inside at a desk, but it does have its implications on your health, doesn't it?
Absolutely.
Juststand.org is that website. Thank you, Dr. Walker.
You're welcome.
And I'm going to stand through the next commercial break as well, just to make sure I'm good. We'll be right back.